each tissue, the suture step will be equal. For example, for the skin, the best suture step it is 1.5 centimeters. For the intestinal wall, it is 0.3 millimeters. For the muscles, it is half of centimeter. For aponeurosis, it is approximately 1 centimeter. Let's say for different tissues, there are different, but of course, the same tissues, it is the same. Logic is simple, guys. Suture step will be enough to give the good gripping of two margins to each other, not more and not less. If it will be more, between two neighboring sutures, margin cannot be normally touched to each other, or content of some, for example, tubes can come to outside. For example, if for intestinal wall you will apply suture step as for the skin, feces will come to outside and will give the inflammation of the peritoneal cavity, which we call peritonitis. So remember, please, about it. That is very important. What about piercing distance? Piercing distance, guys, that is the distance between your piercing point and margin of the wound. Piercing distance also for each tissue is same, for same tissue is same, and for different tissues is different. What is the necessity of this distance and what it is provided? If the piercing distance will be more than enough, then you will tie the knot, you will decrease the size of the tube and will make the passage of its content impossible. Then if it will be smaller than necessary, then you will tie the knots, thread will cut the margins and go to outside, because you will apply big force during your work. Let's say it will be not more than enough and not less than enough. Let's say last year rule said that sutures should be enough strong. Because if I will say maximal strong, you will imagine that I will tie so much the thread that it will cut everything and come to enough. What does it mean enough strong? Again, to give the good gripping of two margins to each other for the future regeneration and prevent passage of some organ contents to outside. This means enough strong. Especially enough strong sutures is necessary for movable structures or for the structures under the tension. Now imagine that I connected two parts of intestine to each other. Intestine is movable structure. There are peristaltical movements. If the sutures will be not enough strong during the peristaltical movement, it will be destroyed and we will have formation of peritonitis. Again, same intestine, it is the wall under the tension, because inside of intestine there are content which is pressed from inside to the wall of the intestine. And of course, this pressure from inside can also destroy the suture lines and can make formation of peritonitis. Again, same intestine, it is the wall under the tension, because inside of intestine there are content which is pressed from inside to the wall of the intestine. And of course, this pressure from inside can also destroy the suture lines and can make formation of the peritonitis. Idea is understandable for you. That's why this is very important. Try to remember, please. Let's continue. I'm very sorry, 1 minute I will make one call. Connection and disconnection. Is it understandable for you? Please, friends, if you have any questions, it will be good to give it now for me, or accumulated the problem for the future, please. If there are problems, ask me.
So what if the piercing distance is more? What?
If it will be small?
No, more. Piercing distance will be more.
If it will be more? Now imagine that you connected the tube. First of all, let's speak about tubular organ. And you apply very far this piercing distance from the margins. Then you will tie the knot, you will critically decrease the size of this tube. I think it is simple to be understood. For the skin, if you will apply normally on the skin, piercing distance, it is equal to the half of centimeters. If you will apply very big, for example, I don't know, 1.5, 2 centimeters, then you will tie the knot, margins will be deformated, because the huge amount of the tissues will be pressed between two piercing distances of your suture. Let's say, and big size and small size is forbidden. If you will apply small on the skin, especially in the regions with low elasticity and low movement of the skin, then you will apply big force to connect these non-elastic margins to each other. Your thread will cut the margins and will come to outside. That is very simple. To arrest the bleeding, I can mediate these vessels. I can suture these vessels. I can make coagulation of these vessels. I can apply hemostatical sponge and arrest the bleeding. So there are different methods. If it is magistral artery without which we cannot live and which is forbidden to be closed, I will apply the wall sutures and I will close the defects and I will prevent the bleeding. I make recanalization using some vascular type of, or I can use the prothesing to, for example, change some crushing piece of the vessels, I don't know. To make bypass, recanalization, revascularization. For example, if the coronary vessels is closed, you know, the bypass surgery we use. But anyhow, we cannot live without blood and without circulation of the vessels. Say some vessel, it's impossible to imagine any incisional operation without bleeding. There are some special surgical manipulations without bleeding. Classification I gave you, yeah, last time, or no?
Yes. Yes, sir.
Let's say we have operations with bleeding and without bleeding, which is called the manipulations. For example, if I will insert it endoscope in your nose, it will not generally give any bleeding. But if I make incision, it's impossible to imagine any incisional surgery without bleeding. If you see bleeding, it means you damage vessels. It is not critically hard usually because we cut the main vessels. Why you don't cut the main vessels? Because you study my subject. My subject is teach you where is located the main structures. For example, then I read now for you principles of disconnection. I told you that if it is possible, make your incision parallelly to the main vessels, which is located in this region. Another questions, guys? Right, please, the surgical instruments. And group, you can come near me. Groups of the surgical instruments. Okay. As I said before, we have 5 groups of the surgical instruments, and inside of each group we have the instruments with some same characteristics. And group number 1 of surgical instruments we call surgical instruments for disconnection of the tissues. Disconnection of the tissues. And another way we can call these instruments sharp surgical instruments. Because using this instrument I can disconnect it or I can cut the tissues of the human body. Cutting, as I said you 2 minutes before, we can use during first stage and we can use during second stage. For example, during surgical access, incision. During second stage, for example, I must make resection of stomach, cutting of part of the stomach and removing of them. Of course, for that purpose, I need the instrument for disconnection. We don't use the first group of instruments for last stage, suturing of the tissues. But during first and second stage, we can use them. Group number 2 of surgical instruments, it is the instruments to arrest the bleedings. Or in another case, we call hemostatical surgical instruments. Which instruments we have here? That is the instrument which is used to arrest the bleeding. As I say you, for your friend answer, if you make any incision, you damage the vessels. If you damage the vessels, it gives the bleeding. If it gives the bleeding, you must arrest it. Otherwise, if we will lose critical amount of the blood, we will be dead. Or we will have big problems. Let's say group number 2 is created to arrest the bleeding during operation or after some traumas. Doesn't matter. Then we come to the meat part of my table. Here we have group number 3 of surgical instruments, which are called general surgical instruments. By the way, before come to the general instruments, about second group, I want to tell you that second group can be used during first stage and during second stage and sometimes during the third stage, because then you make the suturing of the structures by your needle. You can perforate it, the vessels, for example, and it also can give the bleeding. Of course, then you make access. You have the bleeding, then you... That's why we try to close and suture all the tissues to prevent the formation of the new cavities inside of the body, which can give the inflammation. Rule number 2, it's very simple. It said that we can suture to each other only same tissues, homogeneous tissues. Because if I will connect different tissues to each other, first of all, again, function will be loose. If I will connect muscle with the bone, I don't know, skin with the fatty tissue or something else, That is stupid, that is not good. Scar will be very weak, because good regeneration we can have only between same structures. If you connect different structures to each other, of course we will have weak communications, weak connections. Remember please about it. Rule number 3 is also very simple. It said that there are 2 special measurements about which you must remember. First we call suture step, and second we call piercing distance. What does it mean, suture step? Now look please to the blackboard. Look please here. For example, this is the structures which I want to suture. Distance between 2 neighboring sutures, this distance, we call suture step. This is suture step. For each tissue, third stage of the cell, for example, during second stage, which kind of connections I can do? For example, I need to apply anastomose between 2 different organs. For example, stomach and intestine. Of course, for that purpose, I want to suture the tissues. Or, for example, I need to apply stoma in the stomach wall. Of course, I must suture the stomach with the tissues of anterior abdominal wall. Let's say this is normal. Let's continue. Now, let's say during second stage and during this third stage, we can use the methods of connecting of the tissues. Rule number 1 is very simple. We must connect the tissues layer by layer. What does it mean? If I disconnected structures layer by layer, I must connect them also layer by layer. For what? For example, imagine that I cut 5 layers, but I'm a lazy person. I don't want to suture each layer by layer. I want to suture only first and last. Middle layers, which is between these 2 layers, I don't want to suture. I don't have time. What will be happening in the future? First of all, I will lose the function of not suture structures. Second, cavity will be formed between the layers. And of course, by the physical rules, during the time, it will be filled by the liquid. Which liquid? Pus, blood, I don't know, serous liquid. Of course, primary, not pus. Normally, we don't have pus. But blood will be accumulated. During the time, we can have inflammation inside of it. It can give the inflammation and formation of it. They can contain grooves or grooves with the teeth, or nothing, not the grooves, not the teeth. Remember, please, these surgical instruments we call Kocher, arterial forceps. It has the grooves, it has teeth, and it has blunt teeth. This one we call the Bill rods, arterial forceps. Again, blunt teeth and only grooves. If it has sharp point, we call it mosquito arterial forceps. If it doesn't have not grooves and not the teeth, we call it Pean's arterial forceps. Usually Pean's forceps used in pediatrical surgery because it's very polite. It doesn't crush the tissues. Because you understand that grooves and teeth, it is created for better gripping. But in the same time, this is traumatical structures. They can crush the tissues. About this teeth, of course it is for good gripping of structures, but it is not applied on the wall of the vessel. It is applied to the neighboring structures. If you will apply it into the wall of the vessel, you will make more bleeding because it will perforate it. Let's say if neighboring structures is not so much polite and you need the hold, make the strong fixation, you use this kind of instrument. But if near of your artery, for example, there are the vein, of course you will not use it because you will perforate the wall of it. Anyhow, remember please, this is for gripping of the tissues. Which kind of arresting of bleeding we can make by arterial forceps? Of course, temporal arresting of bleeding inside of the wound. As I say you, there are 4 methods. Now remember, to arrest the bleeding. Temporal method inside of the wound, temporal method outside of the wound, permanent method inside of the wound, and permanent method outside of the wound. What does it mean? Arresting of bleedings temporally inside of the wound. It means clipping of vessels. I take arterial forceps inside of the wound, I find the bleeding point, I apply arterial forceps in this point, it is clip the artery, and during some time, it is arrest the bleeding. What does it mean, temporal arresting of bleeding outside of the wound? I can press the vessels out of the wound according to their projections. I can apply the tourniquets. And I can arrest the bleeding again, not forever, during some times, and it will be not inside of the wound, but it will be outside of the wound. What does it mean, permanently arresting of bleeding inside of the wound? It means I can ligate it, the tip of these vessels, which is previously clamped by the arterial forceps. I can suture. By the way, suturing has two meanings in the surgery. It means I suture and ligate the artery and close it forever. Why we need to suture? To fix the place of ligation. Especially if you ligate arteries, because of the high pressure inside of it, if you will not suture, just only ligate it, it can be clean from the wall of the artery. And suturing, it means closing of defects of vascular wall, recanalization of the vessels. Especially for magistral vessels, which is forbidden to be closed. We must to close defect, or we must to make the prothesing of the vessels, or we must to make reconstruction of the vessel, for example, bypass. Does it understand? They say this is the method inside. Inside of the wound, I can use coagulation. It is also permanent method, forever arresting bleeding. Inside of the wound, I can use hemostatical sponge. That is special sponge from collagen or for fibrin. It is like glue. Then you cut the piece and put it in bleeding place. It is glue, close the lumen of the vessels and the rest of bleeding. All these methods, which I tell you, that is permanent methods inside of the wound. Now, what does it mean? Permanently arresting of bleeding outside of the wound. I will come to this method if no chance to arrest the bleeding inside. For example, your exercise book, it is the wound. And there are here bleeding. And this is the main artery which is supply this region. There are several conditions which doesn't give me any possibility to arrest the bleeding inside of the wound. Which conditions? 100 branches, and I don't have time to find each one. Person will be dead. Or inflammation of the wound. Then inflamed wound we have with bleeding, guys. It is very technically hard to ligate the vessels. You know why? Because of softening of the wall. Vessel's wall, we say, eat the wall of the vessels. Like your knife is cut the bread, samely this ligature will cut the wall of the vessel and come to outside if you will try to ligate it, inflamed vessels. Burning wounds. In case of burning wounds, you don't see the point of the bleeding. You see surface bleeding. So if there are surface bleeding, how I can clip the vessel? What can I do? I must to find the main artery which is supply this region, and if it is possible, I must to ligate this artery outside of the wound. How I can do it? If I know several characteristics of this artery, which I told you before: projection, layer of location, and syncope. According to this knowledge, I can make incision outside of the wound, find the main artery, ligate it, and of course it will prevent the bleeding. But in which case I can do it? If there are another vessels which is supply the region, yeah? Or there are anastomosis. Because if it is single region which is supply this region and I ligate it, it will give necrosis. I think it's very simple. First two groups I explain for you, but it doesn't mean, guys, it is so disgusting. Then you say, sir, we don't study because you didn't explain. This sir dear doesn't sleep in the lesson, but then the time is finished. Your teacher will give you homework and say, please read. If you will need my help, come next time and ask me questions.